Hello and welcome to Massage Science. I am Brandon Cope, and today we're going to do a quick overview of scoliosis. Now, this is a very popular and well-known condition that people have had over the years, but I want to talk about some of the things massage therapists can do and some of the variations with this condition. The first thing I want to note is that this is a spinal curve that happens left to right. So it's not a curve forward and backwards, it's a curve imbalance that you would have in the frontal plane of your body. Now, this can either be a structural scoliosis or a functional scoliosis. Now, when I say structural, I'm talking about a bone abnormality. Usually this is more congenital or sometimes idiopathic, where the bones themselves have sort of deformed to create the imbalance within the spine. Functional would be something different, where it's the muscles that have influenced the spine and pulled them out of balance in just slight degrees of angles. When somebody has scoliosis, they usually have either a C curve or an S curve. A C curve is one big curve that occurs in the spine, just one curve. A C curve is going to be an S curve is going to be two different curves. So you usually have an upper curve and a lower curve, and that'll create two different curves in the spine that creates a different kind of imbalance. With the C curve, usually the same or you have one hip that's a little bit higher and the opposite shoulder will be a little bit higher. In a C curve, typically you'll have the same hip and the same shoulder both being higher. So they have a few different ways that they present themselves. The typical signs and symptoms for somebody with scoliosis is going to be a lot of muscle tension. The muscles around the spine will be trying to brace and trying to compensate, and they get very tight and very painful, and usually a person will have a long chronic situation of pain. If it gets really advanced or developed with somebody, it can even lead into cardiac or lung problems, particularly if their rib cage is getting closed down or cramped and they're not able to expand properly. It can start to push in on the organs and cause difficulties with those organs. Usually the treatments that people will seek out is seeing a chiropractor who specializes in a lot of spinal conditions, physical therapy. They might do some bracing of their spine, and they may even choose to do some spinal fusions surgically, or maybe some bone grafting to try to replace bones if they have severe abnormalities within those. Now, for us as massage therapists, one of the big things that we want to make note of if we're working with somebody who has scoliosis is that we're working with them asymmetrically. So you don't do the same thing on both sides. Usually when somebody has this kind of imbalance, you want to work just on the areas of the imbalance, not both sides equally. Typically, the kind of imbalance that we'll be seeing is where one quadratus lumborum will be shortened, usually on the side where the hip is a little bit higher, and the abductors on the outside of the hip will also be shortened. So it's the opposite side from the quadratus lumborum. And then the adductors will also be a little bit shortened. So you can see how you have this pattern here. The hip is higher, quadratus lumborum muscles are shortened, the adductors on that same side are shortened, and then the opposite side abductors are going to be shortened. And typically those are the areas we'd want to focus on releasing. So we'd want to make sure we know which side is the higher side of the hip. With this, we can do a lot of great work with people, but typically if it's structural, we're mostly going to be helping people with the symptoms and maybe working with medical teams to help relieve a lot of those pains of muscle tension. If it's functional, then we might actually be able to progress them forward towards correcting these muscle imbalances. So it's also important for us to identify which type of scoliosis they have. So there you go. I hope that helps you guys. That's just my brief overview of scoliosis for you. Definitely subscribe, like, let me know in the comments what your experiences and learnings have been with scoliosis. I hope that this video helped you. Thanks for watching.